Hello friends, I'm Dr. Gaurav Kheda. I'm a consultant orthopedic surgeon, joint replacements and spine. Today I'll be talking to you about total knee replacement. Knee replacement is the most common surgery which is being done these days. It is also a surgery which has got a lot of bad name to it because of a few complications that are associated, a few myths which are associated. I'd like to clear all those out today. Now before I start talking about knee replacements, I would like to tell you something about the anatomy of the knee joint. Now, this is the knee joint. Knee joint is a type of a hinge joint. It's a modified hinge joint. It has three compartments. It has the medial or the inner compartment, the lateral or the outer compartment, and the patellofemoral compartment. Uh, uh, Now, what basically happens in osteoarthritis, that is the reason why we do a total knee replacement, is that the joint, it starts to age or it starts to degenerate. And as the joint degenerates, this blue colored cartilage cover, it starts to go away. As the cartilage cover goes, the joint tries to recover from this degeneration process. And in doing so, in the reparative process, these osteophytes, which are like bony spicules, they are formed. Now these bony spicules, as they are getting formed, they start pinching into the surrounding tissues. Surrounding tissue means the ligaments. Basically, four ligaments in the joint, two which are inside and two which are outside. The outside ones are the lateral and the medial collateral ligament, and the inner are the anterior and posterior cruciate ligament. Now, the first ligament to get involved is the medial collateral ligament, which is on the inner aspect of the knee joint. And there is tightening of this ligament which takes place. As the ligament gets tightened, this medial compartment, it starts to tighten up, and there is further rubbing of these bones. As these bones rub, this blue cartilage, it goes away and the bone gets exposed, and the raw bony surfaces rub against each other, causing severe excruciating pain. The patients, they come to us and they complain of pain when they are going up and down stairs. They complain of funny sounds which are coming. They complain of difficulty in squatting, difficulty in cross-leg sitting. So this is the reason why you get all these pains. Now, osteoarthritis is not the only reason why we are doing knee replacements. Knee replacements are also being done for other causes like hemophilia, septic arthritis. Septic arthritis means infections. A few other causes like in post-tuberculosis, or again, it's an infection. Now, there are two types of knee replacement surgeries which are being done. One is the unicondylar knee replacement and one is the total knee replacement. Now, unicondylar knee replacement, what we do is we change only the medial aspect of the joint or the inner aspect of the joint. And in total knee replacement, we change the entire joint. Now, changing of the joint does not mean that we remove the bone from top and bottom and we just put in a new knee. Basically, we're just changing the damaged surface. So, this is the model of a knee replacement surgery. There are 7 cuts which are involved in a total knee replacement. The main cut being the tibial cut, and the other cuts are the femoral cuts. Now, the femoral cuts are again, the distal, anterior, posterior, the chamfer, the box. So, once these cuts are done, this is how the femur of the knee joint looks like, of the implant. This is then fitted onto these cuts with the help of a bone cement. And on the tibia, we put a tibial plate, which is again fixed with a cement, and then we put a insert. The size of the cuts and the amount of bone which is being cut is generally decided intraoperatively. The types of implants which are being used are different. The types of implants vary. We have patient-specific implantations. We have computerized implantations, in which we can take computerized cuts during the surgery. And we have high flex knees, we have normal knees. It's a huge variety of knees which are coming. Now, coming to rehabilitation process after the surgery. The rehabilitation process for you as a patient is the most important. See, normally the patient requires 2 to 3 months to recover after the knee replacement. We make the patient walk after 24 to 48 hours. Now, the reason why we are making you walk so early is so that we can get your knee to start moving, we can prevent complications like DVT, and we can start your physiotherapy for muscle strengthening as soon as possible. Your physiotherapy will continue for at least 2 months after the surgery, and you will be able to lead a completely normal life. There is hardly any activity which is going to be restricted after your surgery. You can go for your cycling, you can go for your mountaineering, you can go for your running, you can go for your walks. we will only advise you not to be squatting and not to be cross-legged sitting. Other than these, you will be allowed to do all other activities. The complication rates of the surgery has come down tremendously. About 10 years back, the complication rates were much higher. Now the complication rates have really come down. That is because the most common complication is infection. Now, infection, the methods which we're using in this surgery, they are better antiseptic methods that we're using. There are better barriers which are there in the hospital, better antibiotics. So, infection rates have come down. The other things were the failure of the implants. There is a much better understanding of how the knee is functioning. There's a much better understanding of what the soft tissue balancing is required. So all these complications have really come down. So I would advise you that if you're really suffering from a lot of knee problem, if you're having to take a lot of painkillers, if you're not being able to do your daily activity, then you should get in touch with us and you should start thinking of a knee replacement surgery. You can contact me and come and meet me at my clinic at Dr. Kheda's Wellness Clinic. I'm here every day in the evening from 6 to 9. I'm also available at RLKC Metro and Apollo Spectra Hospital. You could call me or you could text me, and you could also get into video chat with me through LiveRate. Thank you.